After the client has refrained from caffeine and nicotine 30 minutes prior and rested 3 to 5 minutes, make sure that their feet are in a flat position, their arm is rested in supine, and their back is supported. After this, check the cuff to make sure all of your pieces, the bladder and the dial are all where they need to be. Check the cuff size, making sure that the cuff can be fit around the arm and falls into the white range. Double check to make sure that the bladder is closed. The easiest way to remember this is righty-tighty, lefty-loosey. Place the cuff on the arm, making sure it's bare. If they do have long sleeves, please roll them up. Make sure the cuff also is about 2 inches above the inner portion of the joint, lining up the brachial artery with the line on the cuff. After this, double check to make sure that you can see and feel the pulse, that the prongs of your stethoscope are faced out, and that you can hear everything perfectly fine through the stethoscope. Next, place the dial where you can easily read it as you're taking the blood pressure. The dial is read in milligrams of mercury, and as you pump the bladder, double checking to make sure it's all the way to the right and closed. Pump the bladder to 220 millimeters of mercury. Once you're there, you can start releasing by turning the valve to the left. 2 to 5 milligrams of mercury drop per second. The first sound you'll hear, the Cotta-Cough sound, is the systolic blood pressure. And you will listen until you can no longer hear the thumping sound, and this will be noted as your diastolic pressure. This client's blood pressure was at 116/72, which was perfectly normal. Once you're done taking the blood pressure, make sure that you turn the valve all the way to the left to release it and allow the client to rest for another 3 to 5 minutes before retaking another blood pressure.